Hello and welcome to this week's What Were They Thinking? Among the many items this week, we have a significant change in Canada's health policy direction when it relates to the CCP virus. A rather cynical take by the developers of the AstraZeneca vaccine and the idea of herd immunity. Synthetic neurons that could theoretically be able to retain memory using ions to change their state. And some of the more disturbingly sized fossils being found across the world. Let's start with the change in Canada's healthcare policy, specifically Alberta, and the decision to remove mandatory isolation for those who are being tested and have been found positive for the CCP virus. This policy changes on the 16th of August, so only in a few days from this video going live. And other areas like Ontario are significantly concerned. Simply put, the number of people who will be infectious and freely moving will increase drastically as a result of this decision. That means more exposure sites and more risk of infection for something that is otherwise entirely avoidable. As unpleasant as the concept is, isolation or quarantine for those individuals who have tested positive for the CCP virus is an effective method. In fact, it's an effective method for just about every transmittable disease. It's why people who have influenza are advised to not go into work. While, for instance, if you had influenza, you may not know in the early days of being infected, or even if you were at an exposure site. This is not true of the CCP virus, which has, in most countries, some sort of track and trace system to alert individuals who have been exposed or may have been exposed. This allows them to isolate for a period of time until they know whether or not the risk has passed. Those who fall into the category of possibly being exposed will also no longer be required to isolate. It's still strongly suggested, and the fact that that suggestion remains in effect means that at least someone in the Canadian government in that area recognizes that this is a bad decision. The justification behind this appears to be that more than half of Alberta has been fully vaccinated, that is, 2 doses of a 2-dose regime or one of a single dose, and about 64% has received at least 1 dose of a 2-dose regime. This is still nowhere near enough. Most models rely on 80% or greater figure, and that 80% assumes complete coverage. Realistically, an 80% figure is going to have a much lower application rate. So now Alberta's in a situation where they're going to have much higher spread rates, which means your R factor is going to go through the roof. You're not going to have a fully vaccinated population, and people are going to be moving freely. This is going to lead to a drastic increase in the spread of the CCP virus across that part of Canada. And this is what has others concerned. What about if they move interstate, so from, say, Alberta to Ontario? You could have a massive movement of a lot of infectious individuals. Next is an interesting take on something we've been saying for a while, which is there is a good chance that children are possibly able to be infected by the CCP virus, and they may carry the disease home. Or alternatively, they may pick it up from the parents and keep it within the household, or take it back to schools and spread it there. At least according to one article we have, this is exactly the case. At least one very young child is on ventilators, and the CCP virus, specifically the Delta variant, is spreading throughout New Orleans amongst children. There has been what is frankly a rather worrying increase in the positive test rates amongst children. It's gone from 1% a month ago to 7% 2 weeks ago and now 20%. Those kinds of increases are always a cause for massive concern no matter why, but particularly when we're looking at the very infectious Delta variant. These are the concerns we've had for a while now with the possible spread of the CCP virus and return to school or changes in season. For example, in the Northern Hemisphere, when winter comes again, there's a good chance people will be increasingly exposed to each other indoors. This will lead to a significant increase in the possible spread. children returning to school will be in the same boat. There's a chance that they will expose each other and spread it amongst themselves and then the families attached to them. This creates a new reservoir that we've not had to deal with so far with other variants, as those variants have had less impact on children and not seem to have been as likely to spread. And yet we're getting a lot higher infection rate amongst children with the Delta variant. In other changes to policy, the CDC has taken the stance that pregnant women and those who are breastfeeding should begin getting the vaccine. This largely makes sense, as there appears to be no notable effect for pregnant women according to the data. There's no changes in rates of mortality or incidence of diseases from getting the CCP virus vaccines. As a consequence, there's no immediate harm foreseeable for anyone with this. By being vaccinated, both pregnant women and those who are breastfeeding protect themselves and their offspring. Pregnancy by itself is a significant risk factor for many diseases. The strain on the human body tends to be quite high, and as a result, all the resources that are being put into that are having to be rerouted from other things, like the immune system. And it's why there's more demand for energy, nutrition, and other supplements. If you either don't have those or haven't accommodated for it, it can leave you in a somewhat weakened state, which will occur regardless, but it's exacerbated. This puts pregnant women at much greater risk. The fact that the vaccine's safe doesn't really help in that respect though. There is still a huge gap between the women who could receive it and those who have received it. The statistics for those who were vaccinated against those who weren't and had a pregnancy that went to completion during the CDC study of this more or less showed that the vaccinated cohort sat in exactly the middle or lower than average for the rest of the population for any kind of side effects or complications during pregnancy. This means that they either had a better chance of not having complications or the same chance as someone who had not been vaccinated. In theory, approvals or endorsements like this would have been a lot more use anywhere between 6 and 12 months ago when vaccines were first available and could have been distributed on a large scale. This is important as we now have variations like the Delta variant that are proving to be more and more of a problem than the others. The Delta variant is the one that's mostly on people's mind, and it's the one that the Oxford-AstraZeneca group that made the vaccine has now written on. The short version of this is that they're concerned that with the Delta variant as it is and how it is, herd immunity may now be beyond us. And that's a big problem. We mentioned early on in past videos that there was a concern that it would mutate to such a degree that it would become like the new influenza virus, something that changed seasonally, had huge impact, and easily spread through the population. A professor of pediatric infection and immunity at the University of Oxford said, "We know very clearly with coronavirus that this current variant, the Delta variant, will still infect people who have been vaccinated. And that does mean that anybody who's still unvaccinated, at some point, will meet the virus." The other thing they raised, and this is even more of a concern, is that there is a good chance that the next variant of the CCP virus will be even more effective at transmission, infect more people, and possibly be even more resilient to the current immunization regimes that are available. This is the same sort of phenomena we see with influenza. The influenza virus can still infect you if you get the vaccine, but it will not be anywhere near as hard on your body and you'll recover much quicker. Despite this, you can still be infectious and spread influenza. It is possible that the CCP virus will go down the same pathway as far as vaccinations and the transmission variables go. In much more positive and, frankly, successful news, a more successful anti-vaxxer pediatrician has been censured by their state medical authority. They go by the name of Dr. Bob Zajac, and they are Minnesota-based, which means USA. They made a rather large number of very poorly evidenced or unsubstantiated claims, and in the words of Carl Sagan, miraculous claims require miraculous evidence, something which has, fundamentally, never really been supplied by any anti-vaxxers, at least on the scale we're talking about here. With poorly evidenced claims and a variety of other issues, the obvious next step for someone with this level of quackery was to start on, well, all manner of things. What got the good doctor in trouble in this case was not just that he's an anti-vaxxer, but that what he was doing wasn't in line with medical practices that are considered appropriate. The charges or challenges he faced in particular are that he notified patients that vaccines are unsafe and encouraged parents not to give standard or routine vaccinations. Think of things like MMR, for instance. While we'll accept the premise that no patient who doesn't have a medical qualification can truly have complete and utter informed consent, at the same time, a doctor doing their job properly should provide all the relevant information in an easily digestible format that can be understood, and then provide any further information that's requested, not provide their own commentary and editorial in the form of the proper informed consent procedure. And in short, this is what Dr. Zajac has admitted to as part of the sanctions proceedings. The summary of it reads, the investigation revealed that Dr. Zajac is not adequately counseling patients on vaccine risk and safety. The investigation further revealed that Dr. Zajac does not consider vaccines safe, and he notifies patients of this belief during the informed consent process. The conditions upon which this statement and others were entered in included that the doctor must take courses in medical ethics, communicable diseases, professional boundaries, and patient communication. Further to that, they're going to pay a civil penalty. Although the doctors tried to fight this in court and have these sanctions overturned, it appears from our understanding that they have been unsuccessful in their endeavour to do so, which means these sanctions will stand, and they have effectively had to admit guilt and acknowledge that they behaved improperly as a doctor. Although the next news isn't related to vaccines, it could find its way into medical application. The development of synthetic neurons. These neurons by themselves aren't necessarily all that amazing. We've seen similar research in recent years where implants have been used to link parts of broken spines, or allow people in a otherwise incommunicable state to communicate using electrodes in their brain. Where this gets really interesting is the ability of these synthetic neurons to hold on to memories, and they do so by using ions. These are individual atoms like sodium, hydrogen, and similar, with a small charge on them, generally a positive one. These new neurons could be used to create large, almost biological computers if they work. The current ways of storing data are relatively inefficient when we think about something compared to the human brain. Despite that, they are prolific and they have been working fairly well for as long as we've been using computers. But as with all things related to computers, barring graphics cards, we are moving forward with roughly reasonably consistent developments in technology. We're not quite keeping up with Moore's law, but that's for another time. The way this system's designed is that it's meant to behave exactly like a neuron. Movement of potassium and sodium ions into and out of the neuron axon at different times. This carries the action potential or the charge of the neuron along that axon. This allows it to move the signal a significant distance, and as a result, you now have activity, specifically electrical activity. By creating a system in a very, very tiny scale, we're talking atoms between layers of graphene, they're able to create a quasi-neuron that will switch between two states, an energy-rich state and a low-energy state. And this is fundamentally the same way neurons behave. It's also something known as a MEM resistor. As energy passes through it, it forms the state it needs to for high energy. Once that energy goes away, it drops back down to being a otherwise normal state. And so it can switch between these two based on how much energy is available, but it remembers what to go back to each time. So it has two specific setups based on its charge. Something that we don't exactly remember, but has now been found, at least in some detail, is a very large reptilian fossil. Something coming close to 7 meters in wingspan. And, of course, it had to be found in Australia. Of course, in this instance, we're talking about ancient Australia, where you would find fossils, roughly 110 million years ago. So nothing anywhere near modern, as Australia is already dangerous enough. The 7 meter, or approximately 23 feet wingspan, was enough that you would be able to fit a good 3.5 people in it. With such an incredibly wide wingspan, you might be surprised to learn that the skull was just as big, approximately 1 meter in length. This, along with the other features they may be able to identify, such as large teeth, and its ability to fly around in the air, waiting for a possible target to come out of hiding, such as a small mammal, and it's earned its nickname as a dragon. The final news item we have for you this week is all about NASA and the announcement of their recruitment for volunteers to recreate a Mars colony of sorts. The idea here is that they're going to try and create a small colony known as CHAPEA, which is the Crew Health and Performance Exploration Analogue. The 4 team members who will be recruited for this will be kept in there for a year, isolated from everyone and more or less everything else. While they're there, they're going to undergo a series of challenges and hurdles they have to get through. This will be a challenge for just about anyone. You're going to be stuck in a 160 square meter environment, and you won't be able to leave for a year, and you'll be stuck with 3 other individuals. So best hope that you get along with them, because you won't be able to get out of it. The entire module's interesting because it's been created from what is fundamentally a huge 3D printer as well. So we're not just talking about a novel colony, but the entire apparatus by which it's being set up uses some new, interesting and emerging technologies that haven't been really applied in this way before now. NASA isn't trying to sugarcoat what they're going to be doing. The website reads, "To obtain the most accurate data during the analogue, the habitat will be as Mars-realistic as feasible, which may include environmental stresses, such as resource limitations, isolation, equipment failure, and significant workloads." Admittedly, it is a somewhat slight improvement over actually being on Mars, where if something was to go terribly wrong, you wouldn't have any hope. At least here, at NASA's Mars June Alpha facility, you have some hope. That's all the news we have for you this week. Thank you for watching this video. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions that you have below.